It's Jayne Carroll now. Catch the West Side Morning Report with Dave Bourne tomorrow morning at 6 a.m. Only on KUIK.
Welcome back, everybody. Well, it's official. Referendum 301 is on the ballot. That is to repeal the Democrats' tax on that they'd like to implement on your health care services because they're not expensive enough, I guess. Joining us to give us an update on all of this and the election and much more from the brilliant folks at Cascade Policy Institute is none other than the Steve Buckstein. Hi, Steve.
Hi, Jayne. Glad to be with you. Let me make one statement before we start.
Okay.
Before the last couple of days, we were talking about Referendum 301, as you mentioned.
Right.
But now that it's been officially certified to be on the ballot, it is now Measure 101.
Okay, I didn't know that, so I'm glad that's very helpful.
We don't want to confuse people if they look for Referendum 301 and it's not on the ballot. It's
well, at least it's
Measure
close.
101 now.
Now, it's Measure, and when you're gathering signatures, you have a certain number assigned to you, and it's a referendum number, and then when it becomes official, I was very pleased to see that happened. The anti-Second Amendment legislation that just didn't even get off the ground used the excuse that they didn't have enough time. Well, they had the same amount of time, and they got the job done. And
actually, the healthcare tax people had more time because the governor played a legal game with the Second Amendment people and didn't sign the bill till she absolutely had to. They couldn't start collecting signatures, but their time period was the same, so they lost like 35 days.
Yeah. I just want to play kudos to the people that did it because they hit the ground running. They were ready as soon as
and they had a record percentage of validated good signatures, which is really important. I mean, over 85% of the people that signed the measure were found to be valid Oregon voters, and that's why they got way more than enough signatures needed to put the Measure 101 on the ballot.
Yeah, and we've been going through this with so many with, and I'll say this, you don't have to say it, Steve, but this is what I think. Secretary of States that have bent over backwards to try to find ways to invalidate signatures, many of which I think were valid in the past. I think we've got a new sheriff in the Secretary of State's office, and now real signatures are being treated with the respect that they deserve. And so that's good news for the people signing referendums and working on these measures, because you used to have to get way over and above. They would look at one. If there was one signature they could find on it that was fake, they'd throw the whole petition out. Right. It was just it's so hard to get these things done to begin with, and then to have it all piled against you. There are some real positive things happening out there, and this is going to be on the ballot. When are we going to vote on this, Steve?
Well, the vote is January 23rd, 2018, and since Oregon is a vote-by-mail state, that means that they actually have to be at the elections office by January 23rd, so you'd have to mail them back several days before that if you were putting them in the mail. The big controversy now, well, there'll obviously be a big campaign to try and justify raising taxes on people's health insurance premiums and on hospitals, which will increase the cost of everybody going to the hospital. But
because they're so affordable now.
What was that?
Because it's so affordable now for all that.
Right. The legislature, the people that voted for this measure, which, as you say, were virtually all Democrats, tried to, again, from my standpoint, pull a fast one. They didn't use the word taxes. So the ballot measure says that this is whether you want to approve the assessments on health insurance premiums in hospitals or whether you want to oppose them. We want to oppose them, so we want people to vote no. But the word taxes taxes don't appear at all in the official ballot statement or explanatory statement. And the proponents of the referendum, the ones who want us to vote no, have filed basically have gone to the Oregon Supreme Court and said this is not right. The people know these as taxes, and so the court will be listening to that and will make a ruling in the next couple of weeks. Yeah, but whether or not you see on your ballot that this is whether you want to approve new taxes or not, if it says approve new assessments or not, it's the same thing. The assessments are the amount that you'll be taxed.
Yeah, if you have to pay more to the government for something, they call it a fee, an assessment, a gift. It's a tax.
Right.
Yeah, it's as simple as that. So we want to make this really clear. If you don't want the tax, do you vote yes or no? Because sometimes
you vote no.
Okay, so you vote.
It is confusing because the people who put the referendum on the ballot, you would think that they would want people to vote yes, but
right.
The way the referendum system works is we're referring a measure that the legislature passed and the governor signed to increase taxes. And so what the referendum sponsors are doing is saying people should have to vote to approve these taxes, and they can vote yes to approve the taxes, or they can vote no to stop the taxes in their tracks. So we want people to vote no.
Yeah, because people sometimes, when you're repealing something, you think this is a vote to repeal the tax.
It's confusing.
And then they think they have to vote yes. So, and believe me, they'll play off that.
That's right. Now, there should be a clear statement in the voters' pamphlet about what the effect is if you vote yes and if you vote no. We're still waiting to see if they can manipulate that to sow doubt. The one good thing, though, too, is that this will be the only measure on the ballot.
Right.
No other measures, for good or bad, qualified to be on the ballot. So it's a special election. The legislature authorized it. It's costing something like $3 million to run this special election, but that's a sunk cost. That's already done. So people will be getting their ballots, in early January, and we hope people will vote no. That, as you said, these healthcare services and health insurance premiums are high enough. We shouldn't have the government making them even more expensive.
Yeah, they've made them expensive enough already. So this. Do you expect a lot of money to be spent on the pro and con on this?
There will be a ton of money spent at trying to convince people to vote yes. The public employees unions and a number of companies and people in the healthcare business want these taxes. Partly they want them because some of them are matched more than 2 or 3 to 1 by the federal government in the Medicaid program. And the public employees that work in healthcare benefit from all this extra spending. So they're going to be big proponents of voting yes. I'm not sure yet what funding there'll be on our side to vote no. We hope there'll be enough to run a good campaign, but we're not sure.
Yeah, I expect that heavy spending on voting yes, and so you vote no for no new taxes. It's basically it's what we got to keep in mind. If you don't want taxes, you vote no.
Exactly,
and that I think can actually be explained. But they're going to play with the words, and they always do. And that confusion is although when people are confused, they tend to vote no.
Well, that's
they don't vote.
One advantage of a referendum like this is that, yes, when people don't understand a measure, they tend to vote no.
Right.
And that's what we want them to understand it, but we also want them to understand why they should vote no.
Right. So I've heard that some of the hospital associations and stuff are saying we need to put some money in to defeat this because we just can't, especially in the rural areas.
Right. A lot of hospitals, they already pay taxes for the Medicaid program, but this is a new tax on them that they weren't expecting. And the health insurers are probably neutral because right in the bill it says that they can pass this 1.5% tax on premiums on to their customers. So the insurance companies don't care in the sense that they're not paying it; they are literally tagging it on to your health insurance premium.
Any impact on the fact that they did this audit and found initially $190,000 that was overspent on people paying for Obamacare that weren't income eligible, and then that amount about doubled, and so we've been.
It's a lot more than that. Yeah, it's in the tens of millions.
Yeah,
probably a couple $100 million because they found through the audit about 55,000 Oregonians were not eligible for Medicaid, even though they'd been receiving funding. So this measure was passed by the legislature before we found that out. So they basically thought they needed money to cover 55,000 people they don't need to cover, and there are even more. Even though some people are technically eligible for the so-called Medicaid expansion under Obamacare, we've researched this and written about it, that a lot of those people are able to afford some form of health insurance, but why afford it if the government will give it to you for free?
Absolutely, and of course they didn't do a very good screening job. It's another almost like they're setting up the computer system was a debacle. And I actually saw somebody interviewed from the government. We hope the feds don't want their money back.
Yeah, that we'll have to wait and see. I tend to doubt it because they haven't asked for their $300 million back on our failed Cover Oregon exchange program yet.
No.
So if they are going to ask for this money back, it's going to come after that $300 million probably.
Yeah, it's pretty interesting. Where can people go at Cascade Policy to find out more about this?
Well, I just wrote a quick point on it. It's on the website today. It's titled, When is a Healthcare Tax Not a Tax? And it's at cascadepolicy.org.
You're the best, Steve. Thank you so much. Keep up the great work.
Thank you, Jane. Talk to you later.
Okay. Open line 503-648-0101. Toll-free line 1-877-640-1360. We'll be back after these messages.
Jayne